Okay.
Okay, I think we should be good.
Okay, well, yeah, mine said recording in progress. So sorry, everybody. This is, I do Zoom a lot, but only with small groups and not big groups. So have patience with our technical skills here. So supplemental security income, the requirements are you have to be disabled, blind, or elderly. Elderly, unfortunately, is defined as over the age of 65, which I find rather offensive, but that's how they define it. You have to be financially eligible, and you probably all know that you can't have more than $2,000 in resources. So those are your savings. Anything that counts that's not an exempt resource. And they also then look at the income that you receive, both earned and unearned, to determine eligibility. Remember that for someone under the age of 18, parents' income and resources deem to that individual, and a married person, their spouse's income and resources deemed to them. And you probably all know the amount of SSI this month or this year is $914 a month. So unlike SSI, somebody's not muted. I'm hearing my echo through their computer. Can everybody mute, please? Or I'm going to see mute people because I'm hearing myself through your computer and it's a little distracting. So unlike SSI, which is a needs-based program, which provides that $914 a month, Social Security disability income is an insurance program. You're entitled to it because you paid enough quarters of wages, or you have the appropriate relationship to someone who has paid enough quarters of wages to earn the benefit. And there's three main programs under this. There's just SSDI, that's where you're getting it as a result of your own earnings history. There's CDB, childhood disability benefit, which is benefits based on your parents' earnings history. If you were disabled prior to the age of 22, continuously disabled throughout your lifetime, and then a parent either retires or becomes disabled or dies, then the child can collect on the parents' earnings history, which is typically a much higher benefit than their own benefit based on their own earnings history. So the disabled widow benefit is probably not too relevant for us. So Jack is a typical kid who we work with. So Jack applied for SSI when he was 18, started getting SSI, went to school till age 22, and then began working part-time after he finished school. So he now earns $10 an hour for 20 hours a week, which comes out to $860 a month gross. He starts reporting this to SSI, and this earnings is going to decrease his SSI payment to $526.50. And the next slide will go over how that's calculated. But he's working and he's accumulating work credits for his own Social Security disability benefits. Because he's earning $860 a month, he's going to earn 4 credits per year. So he'll have 6 credits after working only 18 months. He'll start at that point receiving a small Social Security disability benefit in addition to his earnings and his SSI benefit. So, and I'm going to go into this in a little bit more detail. So when Jack turns 40, his dad retires, and Jack is now entitled to 50% of his father's Social Security. And that is of his primary insurance rate benefit, which is the amount that his dad would have received if he had worked till the full retirement age, which is what, 67 and some months now. So if Jack's father started collecting Social Security at age 62, Jack's benefit should still be calculated on his dad's benefit that he would have received at age 67. And likewise, if dad doesn't retire and start collecting Social Security until he's 70, he'd be getting a bigger benefit, but Jack's benefit will still be calculated on that primary insurance amount. And then when Jack's father dies, that childhood disability benefit is going to go up to 75% of dad's earnings. So how the earnings impact SSI is in this table. They are counted in the month they are received. SSI disregards the first $20 of unearned income, and unearned income is gifts, payments from a trust, anything that isn't wages for working that a person receives. Then they're going to disregard $65 of the earned income. And then they're going to disregard 50% of the remaining income. So with SSI, going back to work, it's kind of a gradual loss of benefits. And this is one of the significant ways in which it differs from Social Security disability income. You can earn up to $1,913 a month and still get $1 of SSI, which automatically makes you eligible for Medicaid. There are also, for if you are still a student and you're working in the summer, there's a student earned income exclusion of $22.20 a month with a maximum of almost $9,000 a year that they're going to exclude that income. So here is the calculation again. He was receiving full SSI. His countable income from his $860 wages is $526.50. They've basically taken out $85 and then half of the remaining wages, and that's how you get to that figure. So he'll get this reduced SSI benefit in addition to his wages. So he's getting almost $1,400 a month now. So let's say at age 24 that Social Security disability kicks in because he's earned 6 quarters of credit and become eligible for Social Security disability. So his total monthly income doesn't change because he gets his wages, he gets $300 of Social Security disability, but that's going to offset his SSI, remaining SSI dollar for dollar. So he's still getting just under $1,400 a month. And of course, that's gross. And we all know after taxes are withheld and everything, it's not going to be that much. But after he starts getting Social Security disability, 24 months after the first month in which it is paid, or that he's entitled to payment for it, he's going to start receiving Medicare. So Jack, if he was on Medicaid waiver, will have now be receiving SSI of $226.50 a month, Social Security disability of $300 a month. He will have Medicare and he'll have Medicaid. So Medicare will become his primary insurance, but he can keep Medicaid as a backup and keep the waiver and go forward from there. So let's say dad retires at age 67 and 5 months, which is his full retirement age. So Jack will be entitled to $1,500 from dad. Remember, 50%. But because his own Social Security disability is $300, he'll get $1,200 from his dad's to get him up to the $1,500. and he will continue to get his wages. So he will have an income of $2,660 a month, which is good. And when you start getting childhood disability benefits based on a parent's earning, as long as you were receiving $1 of SSI before that started, they can't count that higher income towards your Medicaid eligibility. And that's an important rule to know. The number of quarters of coverage that you need for Social Security disability differs based on your age. For any of us who become disabled and we've been working, we have to have 20 credits, and they have to have been earned within the prior 10 years. If more than 5 years elapses from the last quarter of credit you earned for Social Security disability, you're not eligible for it. A lot of women who worked, had a career, and then took off to raise their kids, if they become disabled, they're not going to get Social Security disability if they've been not working for more than 5 years because of that, that limit. But here you can see that if somebody's under the age of 24, like Jack, all it takes is 6 credits, and you get a credit for each $1,640 earned, and you earn a maximum of 4 credits per year. So that's why Jack started after 6 months eligible for his own Social Security disability. And these other rules, I mean, this explains as you get older, the requirements increase. Unlike SSI, which is a continuing decrease in SSI as you earn more, Social Security disability is more of an all or nothing thing. They're going to look at your earnings, and if you start making earnings in excess, or countable earnings in excess of what they call substantial gainful activity, which is $1,470 a month, you're okay. But if you start exceeding that, that's going to trigger all kinds of things, which could end up as a loss in benefit. They disregard impairment-related work expenses and supports and subsidies at your job. But after your trial work period, if you're steadily earning over substantial gainful activity with the disregards that we talked about, so you subtract those out and it's still over $1,470 a month, then you're going to lose your benefit, which is not probably, there's ways around it, and we're going to talk about how to kind of get around the SGA rule, at least as best we can. Substantial is just defined as exerting significant mental or physical effort. So you're really working, even if part-time, and it's gainful if it's for pay or for profit, or if it's of a nature that would generally be done for pay or profit. So they're looking not just what you're earning, but what kind of the value of your work is. You're allowed to deduct out your impairment-related work expenses, and these are any goods or services that the person actually pays for that is needed to work. So if they need specific durable medical equipment, they need transportation to work, they need a service animal, medications, any of those kinds of things can be deducted as impairment-related work expenses. If they're larger, they can be amortized over a 12-month period, which is useful. So if somebody needed to get a more sophisticated wheelchair or something, they can deduct the cost of that over 12 months to stay under SGA. The other deduction is subsidies or supported work, which are things like extra supervision on a job coach. And these don't have to be things that the person pays for. These can be things that the employer is providing or that an outside agency is providing, but the fact that these additional things are needed in order to be able to work, the value of these can be deducted. So job coaches, if the employer is making allowances for the work you're doing, they're not requiring your work to be of the same value as somebody who is non-disabled, but they're still paying the same. That additional pay can be considered a subsidy, so they can look at the actual value of the work. We have that. We've actually had people who had one young woman who got a job with the county through her father, and it was a really subsidized job. And I think they probably would have gotten rid of her, except she was a union employee, and they couldn't. So she had been earning for 10, maybe 15 years. She'd been earning over $30,000 a year in salary. And we wanted to prove that she was disabled prior to the age of 22 and disabled through her life because her dad had died, and we wanted her to get the higher benefit. And we were able to prove with evidence from the county that the job was subsidized. Had she been being paid the value of the work she was actually accomplishing, it would have been well under substantial gainful activity. And we were able to get her childhood disability benefits. So, you know, you can be creative with this stuff. Other things that are deductible, so business-related expenses. We've had a number of clients where they've kind of started a small business that their family member works in, and they can deduct those business expenses. Have to really document them and prove that they're being paid. Now, Social Security can find that someone is engaged in substantial gainful activity even if they aren't earning $1,470 a month. So if they have someone maybe who is self-employed, or maybe they're working for a family business and being paid under substantial gainful activity to keep the benefits, but they are doing the same work that other employees are doing who are being paid much more. Social Security can look at that and say, we believe that you are engaging in substantial gainful activity. And so we're going to count this as substantial gainful activity, and it's going to impact benefits. We don't see this very often, but occasionally, and more often when someone is working for a family business or a friend's business and they're paying less than comparable employees solely because of the benefits. But remember that substantial gainful activity is a rebuttable presumption. So the presumption is if you can earn more than $1,470 a month, that you are engaging in substantial gainful activity, and you are not disabled, at least for purposes of Social Security disability income. So they look at this, and we find a lot more the opposite, where people are getting paid more than their work is worth. And just because employers feel a commitment to hiring individuals with disabilities, or they just need a lot of coaching, they need a lot of help. And so you can rebut the presumption. Also remember income averaging rules. So if the person is working throughout the year, typically their income might be averaged throughout the year. if they're a seasonal employee and they're only working, 5 months during spring and summer, they will only average the earnings over that seasonal period, not over the whole year. But, sometimes people are working and they get paid every 2 weeks. So you've got a couple of months where you get 3 paychecks. That's where that income averaging comes in, because the average monthly income could be under SGA, but you have 2 months above it. So if you are engaging in substantial gainful activity and they cut your benefits, they will look at it, but within a couple of months, you find, okay, I've been earning this, but I cannot keep the job. I can't do it because it's too much for me because of my disability, or the employer started out with a lot of supervision and coaching and they've taken it away and now I'm failing miserably. Then Social Security will consider this an unsuccessful work attempt and initiate benefits again immediately. So there's a little bit of a stricter rule for this, for if it's more than 3 months, but less than 6 months. And repeated unsuccessful work attempts are really good evidence that a disability exists. So you get people who keep trying to work, they get the job, it pays more than substantial gainful activity, but they can never keep the job more than 3 or 6 months. Then Social Security will look at that and consider that evidence of the disability. So you've got to have your countable wages, or you want to have your countable wages under 1,470. So you're going to deduct any impairment related work expenses, subsidies, business related expenses. And you can also deduct paid vacation and sick time from the pay you're receiving, because you're not actually working for that. You want to keep notifying Social Security of wages, especially if they change, so your income goes up. And if you're making these deductions of impairment related work expenses and all of that, you want to give them documentation of that. I had a client who he was disabled at age 18 in a trampoline accident and became quadriplegic, but he was a clinical psychologist. And he was able to go back to, he was able to work, but he had to have somebody there to do his notes, to do all kinds of stuff. And so the cost of his impairment related work expenses was really high. And so we were able to keep him under SGA, and every month we'd send Social Security a spreadsheet of this is what he earned, these were his business expenses, these were all the things that need to be deducted. And after 6 months of sending that to his caseworker at the local office, he finally said, "You don't have to keep sending this. I've got it. We don't need to get this every month," because it was a lot of information. But it is important, at least at first, to be getting that to Social Security and continuing to get it to them unless they tell you they don't want it. Social Security, remember in that benefit query I talked about at the beginning, it said it would tell you how many months of your trial work period you have used. So a trial work period is any month that you earn more than $1,050 a month, or you're self-employed and work at least 80 hours a month. And so if you accumulate 9 months with earnings this high within 5 years, then you're using up your trial work period, and we'll get into what happens after that. But as long as you're within these first 9 months of a trial work period, they're not going to apply substantial gainful activity test, no matter how high the earnings are. So you have this initial trial work period. And if your trial work period is over for 36 months, any month in which your Social Security disability, less, your earnings less your deductions drops below SGA, then you can get Social Security check for that month. So that's for a 36-month period. And if you, so if you lose it for a 6-month period, you're going to get your Social Security check back right away. And so this is useful. And I think that Helen will be talking about some of the extended period of eligibility for the medical benefits that come with this, like Medicare. But after that extended period of eligibility, there's expedited reinstatement. So if within 5 years after you've lost the benefits, if work stops, they're going to start paying you at least 6 months of benefits. So, and during that time, they're going to conduct another disability review to determine that you're still disabled. And so that's a useful period. So again, if you're trying, and a lot of times we'll have people who have decent jobs and, they're earning over SGA and they go off of benefits because they really like the job. And then the management changes. So you had somebody in there who really was helpful and made this person successful in the job. And then you get somebody new in there who has no compassion, and you lose the job because of that. This expedited reinstatement can help you tide over and lessen until you find another job. So this expedited reinstatement applies if you lost your Social Security disability because of earning over SGA, or you lost your SSI because your earnings exceeded that break-even point, or you lost it because your earnings were higher, but you also started getting unearned income from somewhere. You can't be earning substantial gainful activity if you're applying for expedited reinstatement. You have to be unable to perform SGA because of your medical condition or your disabling condition, and it has to be the same impairment or related to the original impairment that existed when you were on benefits. Also, you've got, again, that 5-year limit for reinstatement. These continuing disability medical reviews pop up. Typically when Social Security finds someone disabled, they classify people as, likely to improve, unlikely to improve, and they'll set time periods during which they will do these medical reviews. For unlikely to change, it might be every 7 years. For some people, it can be much more often, could be annual. So anytime a person, has completed their trial work period, so now they've got that 9 months of earning under their belt, Social Security might look at that and say, we need to look at this person's disability. Or if you start receiving substantial earnings over SGA, if the person reports that they're recovered and they're going back to work and they don't need it, then they'll probably do a disability medical review. So, there's all kinds of things. Sometimes people report to Social Security because they know their neighbors on getting disability and they see them out chopping wood and, doing all kinds of strenuous stuff. And so they get reported. These are done through DODD, and they actually they get updated medical evidence and relook at the existence of the disability. Section 301 payments. probably not too relevant to folks in the DD system. I think they're more relevant if you were disabled as a result of an accident, you started a vocational rehabilitation program, and your condition is improving and you have medical improvement. And so they can continue, as long as you're in the vocational rehab program, they can continue paying your benefits regardless of what your earnings are. Okay, reporting requirements. This is critical. We always encourage, we get lots of calls, should my son take this job? Should my daughter do this, because I'm so afraid they're going to lose their benefits? And, we never advise that people shouldn't go to work because of the benefits. Maybe limit the amount of work, but work is gives structure to people's day. It's a social opportunity. There's so many benefits of it. But what's critical when somebody goes to work is to understand the reporting requirements and follow them diligently, because if you don't, you're not reporting and Social Security isn't getting this information. You don't want them coming back in a year and saying, we paid you benefits for this past year that you weren't entitled to, and so now you have to pay us back. And that's always an unpleasant situation to be in. So when you're on SSI, so you're on the needs-based benefits, you want to report to them anytime you stop or you start working, or if your job changes the duties, or you're working more hours, or you got a raise. If you start paying for impairment-related work expenses or those kinds of things, you need to report that to Social Security. And you also have to report your monthly earnings. You have to get them your pay stubs, and those can be provided. You can open a My Social Security account at ssa.gov. That's a useful thing to have, because you go in there and get all kinds of information from it. There's an automated wage reporting phone system, and you have to report last month's earnings by the 6th of the following month. There's actually an app you can get on your phone, the Social Security mobile wage reporting app, and you can report those pay stubs on that app by the 6th of the following month. Or you can actually just take the pay stubs into your local Social Security office by the 10th of the following month. So that way they have the information, and if you're on SSI, the amount that you earned, remember, is going to adjust the amount of your SSI check. And sometimes the earnings varies every month. The changed check will be 2 months after the month in which you earned the money. So, if your pay is going up and down, so then is your SSI going to go up and down. So reporting requirements for Social Security disability. Again, you have to report if you stop or start work, if your nature of your work changes. And again, if you begin paying or stop paying those impairment-related work expenses. You don't have to report your pay stubs every month to them, although it's not a bad idea to do so that they know, what you're earning. Like I talked about with the psychologist, we did that every month, his earnings plus his ERWIs, just to, show that he was within substantial gainful activity. But the things on the right, you have to report. Again, you can report by phone, mail, or in person, or you can report those monthly wages on your My Social Security account. Social Security often, goes a year before they look at this stuff if they're waiting for your W-2, your wage reporting that you get at the end of the year. And that's why sometimes overpayments are so large. So by repeatedly reporting to them, the hope is that you can avoid those overpayments. The reality may be that they're understaffed and they aren't going to look at it or, get this done for you and still impose an overpayment, but at least you are improving the odds of avoiding that. And you're doing what you're supposed to be doing by doing that reporting. So do we have any questions in chat, Helen? I got done a little faster than I thought.
Yeah, I don't see any.
Do people have questions about what we've talked about so far? Wow. This is such a dry topic, and it's so hard when I can't see anybody. Everybody has their cameras off, so there's somebody with the camera on. Yeah, so it's a dry topic, and we can't see people's reactions. So
There's a question in the chat now, Janet. What is that?
Okay.
SSDI earned income limit.
The earned income monthly limit is that substantial gainful activity amount. That's that $1,470 a month, and it's countable earnings. So if you are earning $2,500 a month gross income, but you have impairment-related work expenses, or you have a job coach that you can show as a subsidization, you can, like I said, you can prove that you're under that limit. But if you consistently are over that limit of $1,470, and you don't prove the work expenses or subsidization, you're going to lose your Social Security disability. Okay, this is a good question, and I'm not sure that I know the answer. I don't know if you can report your earnings on that earnings app for Social Security disability, or if you just can do that and it applies. So apparently you've got somebody who's on SSI and Social Security disability. And maybe the easiest way for that is to get them into your local office, or talk to the local office and make sure that they are, that the app is reporting for both. I have heard of the app only as a way to report the pay stubs for SSI, but it could be effective for both. Is this okay? Another question, is SSDI counted as earned income? No, it is not counted as earned income. It is counted as unearned income for SSI purposes, but it's not counted as earned income. Does that make sense? So remember when Jack started receiving $300 of Social Security disability, that was counted as unearned income. So that basically it caused his SSI to go down dollar for dollar. There's no disregard of half of it as there is with earned income. Anybody else have a question? Okay, well, maybe Helen, we turn this over to you. And
okay, great. Hello, everybody. My name is Helen Rapp, and as Janet mentioned, I'm one of the associate attorneys working at the firm, and I've been here since last August. Prior to working at Hickman and Lowder.
Okay.
Prior to joining the firm, I had worked at the Legal Aid Society of Cleveland, and I worked at GE Lighting. And I'd like to share just a little bit of my background. Like many of you on today's call, I have a child with special needs. My 27-year-old daughter, Jane, has cerebral palsy. And so some of the things that you need to learn about for your children are things that I'm also having to come up to speed on. And, you know, I'm balancing in my family our desire to have our daughter live as independently as she possibly can, with the reality that she will need to remain eligible for Medicaid for the rest of her life. And so this topic, which is very dry and can be very confusing, is really important, because depending on your circumstances, you know, the decision to work or not work, you know, it's very individual. It is complicated. We're covering a lot of material in a short period of time. Really, what I'm hoping that we're going to accomplish for you today is to kind of give you a good overview of this topic, of how government benefits can be impacted by working, and hopefully make things a little bit less confusing for you. Okay, I'm going to try to share my screen now. Okay, I'm not seeing it. Are other people seeing my screen?
Yeah, it's not in slideshow format.
Yeah, okay, hold on. Okay. Is it now in slideshow?
Yes, yeah.
Okay, great. Okay, so what I want to do is spend a little bit of time talking about some of the many resources that are out there that can help people with disabilities who want to work. It can help people figure out if it makes sense for them to work. And the really interesting thing is that the Social Security Administration themselves, they have an entire network of resources that can be really, really helpful. And unfortunately, most people just plain don't know about them. And so they're kind of highly underutilized. And so we want to just heighten your awareness that they're there and point you in a direction where you can learn a little bit more about them. So this next slide, it shows what some of Social Security's resources are that are available to you. And so I'm showing 4 different resources on this slide. And you know, you'll notice that every single one of them has the words work incentive in them. So I've highlighted those words. And you know, that's on purpose. Social Security's goal is to provide people with enough incentives so that they will at least try working if they're disabled. So let's talk a little bit about these 4. There are more, but these are 4 that we felt were, you know, fairly important for you to at least have an awareness of. The first one, the work incentive liaison. This is a person, and every Social Security local office has one of these people on staff. So you could actually go into an office and say, hey, I want to talk to the work incentive liaison, or I want to make an appointment to talk with them. And this person can provide advice to you. They can provide information about what the various incentive programs are that are available, depending on whether you're a SSI recipient or an SSDI, or maybe you're both, or whether you're concerned about Medicaid or Medicare. This person can help you and just give you some advice and provide some information. So it's good to know that they're there, and all you have to do is call or walk in, and you know, you have access to them. The next incentive is the Area Work Incentives Coordinator. This is also a person. There's not necessarily one at every office. This person has a lot of expertise in work supports, and what they do is they'll do a lot of public outreach, and they'll do a lot of training of the people in the Social Security offices so that they're aware of what the different work incentives are. And then the next one is the Work Incentives Planning and Assistance projects. And you'll see that Social Security, like a lot of government agencies, they like to have acronyms. So you'll see WIPA, and WIPA is this Work Incentives Planning and Assistance Projects. And WIPA is not a person, okay? These projects are run by community-based organizations, and in every state it works a little bit differently. In Ohio, most of the WIPA projects for most of the Ohio counties are run out of Disability Rights Ohio. And Disability Rights Ohio it's located in Columbus, but it is the agency for most of the counties in Northeast Ohio. It's a great organization, really, for you to know about. We're going to talk a little bit more about it in the next slide. But essentially, it's what we call the P&A for Ohio, the Protection and Advocacy Organization for Ohio. And they run these WIPA projects. And then the last Social Security resource that we're listing are the Work Incentive Seminar events, which are commonly called WISE. And I've listed a website here too, because you can learn more about WISE on Social Security's Choose Work webpage. And what these are, they're free, they're internet-based webinars. And you can go to that website and you can register for them. You can choose to attend them live as they happen. I think the next one is scheduled for like the 23rd of May. Or if, that doesn't, you're working when it's going on, or you're going to be out of town and it just doesn't, fit for you, you don't have to participate in them live. You can watch them on demand. And if you go to that website, you can see a list of past WISE seminar events that have happened. And the topics are really great and really useful. And, you do this right from your own home. You do it whenever it's convenient for you. So I really recommend check out that website. It's easier than having to call Social Security or go into the office. It's just something you can do whenever you want to. Okay, so there are also resources that are available to people with disabilities who want to work that are outside of Social Security. And so we're listing a couple of agencies that hopefully many of you already know about, maybe already have some exposure to, but if not, you should really learn about them. So every state is required to have at least one vocational rehabilitation provider and one protection and advocacy agency. And so in Ohio, our state vocational rehabilitation provider is Opportunities for Ohioans with Disabilities, which you'll hear people talk about OOD. Actually, that's not right. It's not ODD, it's OOD. So we'll have to correct that before we send the slides out. And the Ohio Protection and Advocacy Agency, as I mentioned in the previous slide, is Disability Rights Ohio. They're located in Columbus, but they're a statewide organization, and they do something rather unique. In addition to providing some of the supports that Social Security directly or that OOD can do, Disability Rights Ohio can actually represent people in legal action in Ohio. So it's a fabulous organization. The services are free, and so you should, acquaint yourself with both of them. So now we want to talk a little bit about what are some of the different work incentives. And again, depending on what program you're on, whether it's SSI, SSDI, whether it's Medicaid or Medicare, the incentives are going to be different. This first one, the PAS plan, and PAS, and that's another acronym. It stands for Plan to Achieve Self-Support. This is a fabulous work incentive. What it does is it allows people who have a work goal to set aside some of their resources and some of their income. And what we mean by set aside is it means Social Security isn't going to count them. So it allows you to actually have more in the way of resources and income if those resources and income can be used to achieve a feasible work goal in a reasonable period of time. And so how do you get a PAS plan? So if you think you're interested, you think, hey, yeah, I have a work goal and it's going to take some money for me to get there. I'd like, to get some relief on my income and resource limits. How do I go about doing that? So what you have to do is you have to complete a plan. It's a written plan, and Social Security has a form for it. It's called their 545 BK form. And you certainly could do it yourself. So I want to be clear, you're not required to have an advocate help you with it. But it really is a lot better if you get some assistance with this, either through Social Security or from some other advocacy group that has some really good experience with vocational rehabilitation. The plans are far more likely to be approved if they've been, if you've prepared them with the assistance of an advocate. And so what needs to be in this plan? You have to show that you have reasonable and realistic occupational objectives. And you have to show, what are my earning potentials if I were to achieve this objective? You have to have some sort of goals for how you're going to get there. You have to document what are the expenditures that I need in order to get there. And then you also have to document what income is it that I have and what resources that I have. Do I want Social Security to kind of exclude, not count, disregard while I'm on these plans that I can achieve my goal? So you get this plan prepared with hopefully the help of an advocate, and then you submit it to Social Security and they hopefully will approve it. So, what are some of the things that you can ask, for? You can ask for transportation or tuition, equipment and supplies. You might need childcare in order to work. You might need attendant care. You can even put meals in there. And so what we thought, rather than just list this, it's still probably not really clear how that would work, is let's take a look at another example. So, here we have Helen, not me, a different Helen, and she's 25 years old. She's not currently working and she hasn't gone to college. She's a partial quadriplegic and she's a wheelchair user. She has a power wheelchair. And she really has this dream and aspiration that she wants to be a kindergarten teacher. And so she's been saving some money. So far, she's got $14,000 that she's saved because she knows to be a kindergarten teacher, she needs to go to college. And she's currently, she doesn't get SSI, she gets SSDI. She's getting $980 a month of SSDI. And this is because her dad is retired and has a work history. And so she's collecting, 50% of what his Social Security payment is. So this is what she has. And she's looked at what is it going to take for me to be able to go to college and get a degree so that I can be a kindergarten teacher. So she's going to need transportation. And so she's determined that the best solution for her is to purchase a van that can be modified so that it's wheelchair accessible. And then she's going to need tuition money. And so she's done some research and she's found out that, she can buy a used van and, she can use some of her money for tuition. And so the way this works, she's talked to OOD, and some of you may know this, you can get modifications to a vehicle paid for a number of different ways if you're disabled. So in Helen's case, OOD has said, hey, we will pay for the modification that you need, which is, going to cost like $23,000, but we're not going to buy you the van. You have to pay for the van yourself. And OOD is also going to cover some of her tuition, but not all of it. And so it's going to leave her with, she's going to have to pay like $3,000 a semester or $6,000 a year, or a total of $24,000 over 4 years for tuition. So, she needs money, and with her savings and her income, she doesn't see a way to get there. So she works with an advocate. She gets herself a PAS plan. It gets approved. And what this plan that Social Security has approved allows her to do is set aside all of her savings. So remember, she had $14,000 in savings. She can set that all aside. They're not going to count it. And they're going to set aside most of her SSDI. She's getting $980 a month. They're going to not count $960 of that. So she can take that money, her savings and her SSDI, and she can use it to purchase the van and to pay for the unpaid portion of her tuition. So that's great, but what is she going to live on? So what now happens is she's considered to only have $20 of income, the $20 of SSDI that she did not set aside. And as Janet mentioned, any income earned or unearned, the first $20 will be set aside. So basically they're not going to count that, which means she's now going to qualify for the entire full amount of SSI. So Helen now is going to be receiving $914 a month of SSI. She's got $20 of SSDI, so she's got $934 a month that she can live on while she's using her other money, her savings and her set aside SSDI to accomplish the goals in her PAS plan. So this is fabulous. She's got more than enough money to do what she needs. Now, the important thing to know, this sounds great, and it is great, it has to be for a finite period of time. So, Helen can't say, I want to do this for the next 20 years because maybe I'm going to go and get a PhD too. The PAS plan has to show I have some reasonable, realistic goals that can make me, get a good job, and I can do it in a reasonable period of time. Here it's for 4 years, and that's considered reasonable. Okay, so it can be a very powerful work incentive. And so people who are disabled and maybe don't currently have the right training to do something shouldn't feel like there's no hope for them to get there. Should look more into the PAS work incentive and see if that's something that can help you get to where you want to be. So the next incentive that we want to talk about that hopefully some of you have heard of is the ticket to work, and you'll see it as TTW. This program has been around. It's a Social Security program. It's been around for just over 20 years now. And it's really fantastic. And so I encourage anybody who has a disabled loved one who they're thinking, might want to work or might be able to work, you should look into this and see what the Ticket to Work program can do. So it's a free voluntary program. You don't have to do it. It's not going to cost you anything if you do it. What it does is it puts the person with the disability in control of when and where and how they're going to access the services that they need in order to be able to work. And so in the early years of the program, if you wanted to use Ticket to Work, you pretty much had to go through the state vocational rehabilitation agency. And again, in Ohio, that would be OOD, Opportunities for Ohioans with Disabilities. But there were some changes that were made to the program back in 2008, which brought into play these employment networks or ENs. And what this did is it opened it up. And so now there's a wide variety of employment networks that, you know, people can choose to work with. You don't have to go through OOD. You can get supports from other community providers. And the Social Security website they maintain a list of who the approved EN providers are in your area. So you can go to the website and you can put in your zip code and you can say, I want to see a list of all the providers everywhere or within 10 miles of my zip code or within 50 or 100 miles, you know, you can choose. And you will see that there's really a lot of options and a lot of them have really started doing a great job for people. You should go to the website and you should play with it. Here in Cuyahoga County, in addition to OOD, you can access Ticket to Work services through a bunch of different places. The Cleveland Site Center, the Magnolia Clubhouse, the Ohio Jobs Network. There's just many to choose from. And what these employment networks will do is they'll work with you and they'll help develop something called an IWP. And an IWP is an individual work plan. And we're going to go into that a little bit in the next slide, but I also wanted to just point out, again, you're going to get these slides afterwards. How can you learn more about Ticket to Work? Because it's a great resource. They have a helpline and it's shown here. So you'll have that in the slides. You can call the Ticket to Work helpline and you can get all your questions answered and you can just learn everything that you need to about it. So what is this individual work plan that the employment network is going to help you develop? It's a written document and it's going to state, well, what are my employment goals? What are the services and the supports that I need to achieve those goals? So this plan will also detail what your rights are under the program. It'll detail what conditions will allow you to amend the plan or terminate the plan, either if you choose to or if the employment network chooses to. And it'll list what remedies are available to you if you're not getting the support that you need from the employment network. And so, you know, there will be progress reviews if you participate in the Ticket to Work program and you've got your IWP and you're working with an employment network and they're providing you with, you know, job coaching and help with your resume and help finding jobs and support once you have a job. There will be progress reviews to make sure that things are going well, that reasonable progress is being made. And it's not something you should be like scared of, like, oh my gosh, what if I didn't hit a goal? If reasonable progress is being made, then everything's going to be fine, and you know, you'll just keep going. And here's something that's fairly important. So as long as you know you're continuing to participate and you're making timely progress, Social Security will not conduct any of those continuing determination reviews, which is nice. Okay, it quite frankly is nice. So you won't have to go through to them determining that are you still disabled, and your cash benefit will continue. So it's a very powerful program. Again, who's eligible for it? You have to be between 18 and 64 years old. Why that age range? Because it's a ticket to work. And so those are the age ranges that Social Security cares that you're working in. You have to be currently receiving disability payments, which means either SSI or SSDI. You can't be medically improved. You can only have one ticket during any benefits period. Okay, so it's a huge program. I covered it probably way too fast, but again, that helpline is phenomenal. They've got a website. I would really encourage you to go and explore it and see if it's worth trying. Now we're going to talk about some work incentives that are specific to SSI recipients. And so I've listed 4 of them on this slide. The earned income exclusion, the student earned income exclusion, property essential to self-support, and something called section 1619A. So we're going to talk a little bit about each of them. Just remember, these are applicable to people who are SSI recipients, not people who are only SSDI recipients. So the first one, you already heard a little bit about this earlier this morning when Janet was going through her slides. She gave some examples and talked about the SSI earned income exclusion. And, this is that basically SSI will disregard or not count the first $65 of earned income. And then in addition to that, they will discount or not count half of the remaining earned income. So let's look at an example. Again, trying not to make this a math class, but sometimes examples are the best way to look at something. So you have a person whose gross income is $665 a month. And so we're going to disregard $85. And you might be thinking, whoa, you just said they're disregarding $65. What's with $85? There's a $20 disregard of any income. So if you have unearned income, they'll disregard the first $20 of it. If you don't have any unearned income, you only have earned income, like this example, then that $20 gets added to the $65. So there's really an $85 that comes off income. So the $665 goes down to $580 because we subtracted $85. Then we divide that in half. So now we're down to $290. So $290 is what's considered the countable earned income for this person. So that will impact the SSI payment. We're going to subtract that from the maximum payment, which was $914. So 914 minus 290 means your SSI payment is now going to be $624 a month. So you have that from SSI, you have your gross income of $665, you add the two of them together, and you wind up with a total income for the month of $1,289. So this is an incentive for people on SSI because we're excluding some portion of, we're happy that you're working and we're going to exclude some of it. So we're not going to hold it against you and ding the full amount from your SSI. We're going to only ding minus $85 and then divide the rest of it in two. So it's a nice work incentive for people on SSI. Now, the next one Janet also talked about, this is the student earned income exclusion. It's a great incentive, but it's only applicable to people who are under the age of 22. So, it's not something that a lot of children are going to be able to use. So you have to be under 22 and regularly attending school. So, and what do they mean by regularly attending school? Essentially, it means that you have to be, taking one or more courses of study and attending classes. And those classes might be college classes. If they're college classes, you have to be attending at least 8 hours a week. They might not be college classes. You might be, your child might be still in grades 7 through 12. If that's the case, they have to be attending at least 12 hours a week. And you might be in some type of employment training program. If that's the case, you have to be participating at least 12 to 15 hours a week in order to get this exclusion. So if you meet that criteria, you're under 22 and you're attending the right number of hours of classes, they're going to disregard up to $2,200 a month of income. Now, not for all 12 months of the year, but they'll do that for a maximum of $8,950 for a year. So they won't count that income. And this is not instead of the other exclusions. They do this first, and then you still get the $65 exclusion, the $20 exclusion, and the half. So very, very nice work incentive for young people who are, involved in some type of schooling. So the next one, the PES incentive, which is property essential for self-support. This work incentive, instead of looking at income, is looking at resources. And, let's remember that as a general rule of thumb for SSI and Medicaid, you can't have more than $2,000 in resources. But what this incentive does is it says, if there are things that you need in order to be able to work, certain property that you need for business, personal property, we're going to exclude that from your $2,000 resource limit. So this is a nice incentive too. So, it can be a lot of different things. It can be equipment that you need, or, different types of property. Liquid resources, stocks and bonds, they'll only be excluded if it's something that's used as part of a business or a trade. But it's a nice incentive. This next one, Janet also kind of referred to this. Section 1619A. What this does is it allows people on SSI to go over that SGA amount and still keep receiving a cash benefit from SSI. Remember, SGA, substantial gainful activity, is $1,470 a month. And if you're an SSDI recipient and you're working and you're earning over that, you're going to lose your SSDI. But this section 1619A incentive basically says this SGA rule doesn't apply to SSI recipients. And so you can be earning over SGA and still getting SSI. Now, your SSI, of course, is going to be reduced if you're earning high income, but you'll still continue to receive some SSI until you hit that break-even point. And the break-even point is like $1,913. So you can be earning $1,500, $1,600, $1,700 a month. You're still going to get some SSI until you hit that break-even point. So that's the section 1619A work incentive for SSI recipients. So now we want to switch gears. We've been talking about incentives really to kind of help you preserve your cash payments, your SSI or your SSDI. But lots of times the concern that you have for your child or your loved one is, I really need to protect their health insurance. I need to protect their Medicaid or their Medicare. So first we're going to talk about, incentives that basically allow you to protect Medicare for SSDI recipients. So if you recall, what Janet said is, if somebody receives SSDI, after they've been on SSDI for 24 months, so at the start of the 25th month, they will automatically get Medicare, which is fabulous. Okay, so people have Medicare, they have SSDI, they might be concerned that I don't want to work because I don't want to lose my SSDI because I'm going to lose my Medicare. And that's not true, or at least it's not true quickly. So what you have to remember is there are two ways that you can lose your SSDI. You can lose it because you have medically improved and you are no longer considered to be disabled, or you can lose it because you're working and you're earning more than SGA. So this incentive is for the people who are working and earning more than SGA. So I want to be really clear about that. If you lose your SSDI because you have medically improved and you are no longer considered to be disabled by Social Security, you will lose your Medicare. There's no protecting that. So this extension of Medicare is for the people who continue to meet the criteria of being disabled. They're working, they've gone past their trial work period, and they are routinely above SGA. They're losing their SSDI. They will keep their Medicare for 93 months. And that's really a big deal. That's almost 8 years after the end of a trial work period. You continue to work and you're above SGA, you're keeping Medicare for almost 8 years. So, okay, what happens after the almost 8-year period? I'm still disabled. I still would like to keep my Medicare. And the answer is you can. You will have to, you'll have to pay for it at that point, but you will be allowed to purchase parts A, B, and D of Medicare, and the premiums are reasonable. And so it, in most cases, is going to wind up being a more affordable option than other healthcare might be. So there's really significant protection for Medicare for people who had SSDI who want to try to work. So, you know, it's still an individual personal choice, but you know, you shouldn't be frightened by hearing people say, if you work, you're going to lose your health insurance. Nothing is going to happen quickly. The rug is not going to be pulled out from under you. Okay, so that's Medicare, and that's important to people who are getting SSDI. But a lot of people are on Medicaid, and they want to make sure that they can keep their Medicaid. And this can be applicable to both SSI and SSDI recipients, because, you know, the SSI recipients automatically get Medicaid. Some of the SSDI recipients get Medicare and Medicaid. You know, they may have been on SSI and then they were able to get on SSDI. So they have both. And they want to keep the Medicaid because, as we all know, there are certain things that only Medicaid is going to pay for. And so we need to keep Medicaid. So there's 2 programs that we're going to talk about that will allow people who are working with disabilities to keep their Medicaid. And the first is 1619B. Remember, we already talked about 1619A, which allows SSI people to not have to follow the SGA rule. 1619B is an incentive that will allow you to continue to receive Medicaid, even if you're working and earning money too high so that you're not receiving SSI. And then the other program we're going to talk about is the Medicaid Buy-In program for workers with disabilities. Okay, so 1619B, what are the requirements? So you have to have been eligible for SSI for at least 1 month. You have to still be disabled, meet all of the disability requirements. You have to need Medicaid in order to work. And you know, you don't have sufficient gross income to cover all of your needs. And so, you know, if you meet that criteria, you're going to be able to keep your Medicaid up to a certain point. And what is that certain point? It's the threshold level. And every state has a different threshold level. And in Ohio this year, the threshold level is $41,830 a year. So that means as long as your income is below $41,830, you can keep Medicaid through the 1619B growth incentive. So what you need to remember is you won't be getting a cash payment at this point, okay? If you're earning $41,000 a year, you've lost your SSI. You're not getting any SSI money, but you're going to keep the Medicaid. Okay, so the other program, and this really is applicable, to SSDI people. You're working and you're making over that $41,000. You've got, maybe a very strong income, and you still need Medicaid because there's just certain things only Medicaid is going to pay for. You may be able to participate in MBIWD, the Medicaid Buy-In for Workers with Disabilities program, that will allow you to keep Medicaid. You may have to pay a small premium for it, but to keep it. So who does this apply to? What are the eligibility criteria here? You have to be between 16 and 64. Again, they're going to cut it off at 64 because this is for people who are working age. A lot of us are going to be working past that, but that's the current age range. You have to be disabled. You have to be employed in paid work. So you have to be being paid. It can be part-time. It doesn't have to be full-time. And you have to have countable income below $56,450 a year. And we're going to come back to that. And you have to have countable resources below $14,318. So a lot of people who have been, living with that god-awful $2,000 resource limit, this is fabulous. Suddenly you can have, $14,318 in resources. You may have to pay a premium. It will be determined based on what your income actually is. If you do have to pay a premium, it's still going to be a reasonable premium. It's going to be a whole lot less than private insurance. You have to be a citizen or meet Medicaid citizenship requirements. These programs are run by the individual states. So in our case, you have to be an Ohio resident and you have to have a Social Security number. I do want to talk about countable income. So I'm showing there, you have to have countable income below $56,450, which is it's a good income. So, that in and of itself is a good income. But a lot of earned income is not countable. So a person could in fact earn significantly more than $56,450 a year and still qualify for this program. Because if you recall, the work incentive for the SSI work incentive is they're going to discount half of earned income. So half of earned income gets discounted. So you could in fact earn about $112,000 a year and still qualify for the Medicaid Buy-In program for workers with disabilities. So this is another fantastic option for people who want to work. So we're at the end of what we've prepared. We're going to have time for questions, but put this slide up because we've covered a ton of stuff today in a really short period of time. And you could, in fact, spend months or even years trying to understand the nuances of all of the different programs we've talked about and the resources that are available. And so, my hope is that this has been helpful. I'm thinking your heads might also be spinning a little bit because there's all these different numbers and different programs and which benefit do they apply to and which benefit do they not apply to. This Red Book is a Social Security publication that they update every year. And I mean, it is fabulous. Everybody should familiarize themselves with it. They've listed the website, so you can go to Social Security's website and they have a page on the Red Book. You can read it online, you can print it online. If you don't like reading these things on the computer, you can order yourself a hard copy. I think it's like 55 pages and they'll send it to you. It goes over in detail in plain English, not legalese, all of the different programs we've talked about, all of the different incentives. It's just great. It's a deep dive that goes well beyond what we're able to, cover in an hour and a half or 2 hours. And so I encourage everybody to go to that site and at least look at the web book, and it'll be updated every year. So the numbers are always going to be current. You don't have to worry about that. Okay, so that is pretty much all of the material that we have prepared.
We do have, there's one question in the chat.
Okay. Let's see. Hold on, let me get that back.
You may have to stop sharing. Can you?
Yeah, I think I do. Okay, great. Okay. So my son started working after a 2-year hiatus due to COVID in August of last year. I overlooked responsibility to notify Social Security. What should I do? So that's a great question. Might be more of a Janet question, but I think we do need to contact them.
Yeah, I would just go ahead and let them know, and probably through your local office, just let them know you didn't realize you should have notified them and you're doing it now. And hopefully the earnings haven't been over SGA or, creating issues. So.
Yes, so can Social Security mail you a red book? Yes, you can. You still have to go to that website. So you'll have to go on the computer at some point. Or I suppose you could call them. You could probably just call them and say, hey, I want a red book. I know if you go to the website, there's a link you can click on and say, can you send me the publication? And actually go to that website, because in addition to the red book, they have a lot of nice publications. They really do. And, I feel like most of us in this space kind of have like a love-hate relationship with Social Security. Like sometimes we're thinking that they're evil and they're, just trying to find ways to screw us. But the reality is there's just a treasure chest full of great information there. They do want you to understand the different rules and programs. And so go and play around on their website and see what other things in addition to the red book are there that might be really useful for you.
Yeah, there are some real good pamphlets. I don't know if I can get this in focus. This is one of them. Okay, I can. Working While Disabled, How We Can Help. You can get that online at their website as well. And, they're really, as Helen said, it's great. And Social Security isn't evil, just the occasional caseworker is evil.
Right.
And if you don't like who you're dealing with, get somebody else, because it can make a huge difference in your experience with the agency.
Right.
There's another question we kind of skipped over, and that is what organization administers the Medicaid Buy-In program? Yeah, Job and Family Services administers it. So if if somebody's on Medicaid, now they're starting to earn more money or they're not on this program, you just need to contact the Medicaid caseworker and say, hey, I should be on MBIWD. And if you meet the requirements, which is having some earned income, working, then it's going to be available to you.
And, in addition to Job and Family Services is the one that has to do it, but if you're plugged into other agencies for help, OOD or county board, or you have, you're on the ticket to work and you've got, somebody that you're working with, they can also help you too. So a lot of these people can help make the connection for you.
And you can keep your waiver. I mean, if you're on Medicaid Buy-In, you can keep all of the Medicaid benefits. So your waiver, everything. So that's why it's such an important program.
I think the one thing that I think is important for for really all of us to remember, because it's easy to get scared, and like you'll hear people all the time be like, oh, the second you do this, you're losing your benefits. And some person may have lost benefits for some reason, but that's not necessarily applicable to your situation. And so every situation, you know, has its own set of circumstances. And so, you know, try to like step back. I'm not saying don't listen to what you hear from, you know, people in different groups, but try to look at what are the rules, what is my situation, does that apply to me? And just remember, things aren't going to happen quickly. So yeah, Social Security has these work incentives to try to get people to work, because their goal is to have it so that people are not 100% dependent on benefits. They would like it if you could be more independent. But there are safety nets, and they're not going to pull the rug out from under anybody quickly.
Okay, another question. This was a great presentation. Thank you. Well, we hope it was useful. I still can't tell you how difficult it is to talk to a screen full of names and not see people. It's so much nicer in person, but we have to live with what we've got. But anyway, will our recording be available to review or to forward to someone who needs this information? Yes, Stephanie, who is probably the person who sent you reminders about this, will send you a link to the recording. And unfortunately, we missed the first couple minutes, but there was nothing of substance in it, I don't think. But and then it'll also be available on our firm's website. You can go on there and you'll be able to actually just click on a link there to see it again. So we thank you all for hanging in with us for this.
Could I ask? I have a few questions. This is Emily. I don't want to monopolize time or keep people, but I kind of wanted to present my personal case and ask for your recommendations on next steps. So I am 41. I graduated.
Okay, Emily, can we just ask if there's any other general questions first, and then we'll get to yours?
Yeah,
just real quick.
Yeah.
Anybody else have a question?
Well, another one in the chat, Janet.
Yeah, just can I repeat how to get the QRP? And let me get it. And I think you're talking about the benefit planning query. Is that right, Paulette? You can unmute yourself and talk if you want. Yeah. SSA form 2459, or you can call. And when you'll get these slides, and the phone number and the forms needed are on that slide. So when you get a link to the slides, you can see it there. Anybody else with a general question? Okay, I don't see any more. So go ahead, Emily.
Thank you. So I graduated undergrad many years ago in 2004. I worked for about 16 years, but always kept my wages low enough to not impact my benefits. I received SSI. Over the pandemic, I went back to school, and I'm about to graduate graduate school in August. And my internship had made it clear that they plan to hire me on. So I'm very excited about that. It's in social work. And so my understanding is a typical beginning wage is around 50 grand per year. And so what are my next steps? Like, what should I be doing now? I have about 3 months before I potentially start making real money.
Well, yeah, that's exciting. And so you're on SSI and Medicaid now
Yes, yes,
and on a Medicaid waiver.
yes.
You know, your earnings will, at that high, it can be very difficult to get any kind of deductions great enough to, you know, deduct and keep the income benefits. But I would certainly make sure that you get onto Medicaid Buy-In for workers with disabilities
Okay.
so that you can keep your waiver in place.
And so should I start applying for that now, even though I don't have the job yet? Or do I wait until I like have an offer? You know?
Are you getting paid in your internship?
No, I'm not.
Okay, yeah, if you were getting paid for your internship, I would say apply now, but you have to be working and earning to be eligible for it. So as soon as if you get this job and as soon as you start working, then get in there and apply for it.
Okay, and then I have two more questions. Number one is also just got engaged. So does spousal income impact the Medicaid buy-in?
That's a good question. And off the top of my head, I'm not absolutely sure. So you're engaged, you're getting married. Is your fiance, does he have any disability?
He does not.
And he's working a regular job and having good earnings.
Actually not working right now, but plans to be in the future.
Well, we have your email and I'll check on that because I really don't want to give you an incorrect answer and I don't know off the top of my head.
Okay.
I don't either.
And then my final question is, what if you stop, like you're making good money, but then you need to stop working, like maybe 10 years from now, things change and I cannot maintain this. But like, meanwhile, I have a lot more money than I do now, right? Because I've been saving. Like, what happens then? It's, you know.
Yeah, well, at that point, you should have enough quarters of earnings to be eligible for Social Security disability income, not SSI. So your resources and your savings won't count. But if you're still on Medicaid, need Medicaid, then you're going to have that resource limit of 14,000.
Okay, great. Thank you so much. Yeah.
You're very welcome. Now, did this inspire any other questions from anybody? Because if not, I guess we'll sign off a little bit early.
And Emily, like you can also, do you have a stable account?
I do, yeah.
Okay, so I mean, that also can be a way if your resources were higher than.
Right, yeah, good point. Thank you.
Right, and you can put, when you are working, you know, there's an additional amount you're allowed to put into the stable account every year.
Okay, good to know.
So instead of the 17,000, what is it, Helen? And
Oh my gosh, it's like
12,000.
It's an additional 12 or 13,000.
So you can actually put 30,000 a year into your stable account.
Fantastic. Thank you. This has been so helpful. Thank you guys so much.
You're very welcome.
You're welcome and congratulations. You've got a lot of great stuff going on in your life.
Yeah.
I do. Thank you. Yeah.
Okay. So you'll all get a link to the slides. You'll have those. And, you know, if any questions come up, feel free to send an email and we could get back to you with a brief answer anyway. So thanks everybody for attending and we really appreciate it.
Bye, everybody.
Bye-bye.